Let's take a close look of action potential of pacemaker cells versus heart muscle cells and the important differences between them. Main are responsible for the electrical activity within the heart are the sodium, calcium and potassium. When cardiac muscle cells are stimulated by an electrical impulse, their membrane permeability change and ion moves across the membrane, thus generating an action potential. So now the membrane potential in the pacemaker cells started above minus 60 millivolt. When spontaneous flow sodium, mainly through the slow sodium channels, an opening of the voltage gated T-type calcium channels, continuous flow depolarization. This is referred to as phase 4. When threshold potential of about minus 40 millivolt is reached, the voltage gated L-type calcium channels open. The calcium rushes in and rapidly depolarizes the cell to about plus 10 millivolt. This is referred to as phase 0. Finally, L-type calcium channels close and voltage-gated potassium channels open, which allows the potassium ion to escape, thus repolarizing the cell back to minus 60 millivolt. This is referred to as phase 3. After this cycle just repeat itself. There is no phase 1 and phase 2 in the action potential of pacemaker cells. Now we take a look of action potential of cardiac muscle cells. Unlike the pacemaker cells, the cardiac muscle cells have resting membrane potential about minus 90 millivolt due to the constant outward leave of the potassium to the inward rectified channel. This resting phase is referred to as phase 4. When an action potential is triggered in the neighboring cell, the voltage-gated sodium channel open and sodium rushes in, causing a rapid depolarization to about plus 40 millivolt. This is referred to as phase 0. At this point, sodium channel become inactivated and other voltage gated channel begin to open, mainly potassium channels, which allow the potassium to escape, thus bringing about a small depth in the membrane potential. This is referred to as phase 1. During the depolarization at phase 0, L-type calcium channel begins to open slowly, allowing the calcium enter into the cell. So now with the positive potassium ion leaving and positive calcium ion instead to it coming in, we have an electrically balanced ion exchange which keep membrane potential on a plateau. This is referred to a phase 2. Lastly, plateau phase is following by the rapid repolarization referred to a phase 3, which caused by gradual inactivation of calcium channel and continuous outflow of potassium. This brings the membrane potential back to the resting phase 4. Hopefully, you will enjoy the difference between the pacemaker cells versus the heart muscle cells. For the next upcoming video, please subscribe the channel.